Minutes. The chair recognizes the gentlewoman from Wisconsin.
And I do thank you, Mr. Chair. My amendment would simply ensure that low-income communities and that the public health generally of all Americans are considered in the bill's section on studies about the impact of this regulation. I offer this amendment, Mr. Chair, in hopes that we might have an honest debate, a debate that is inclusive of those most affected by the very policies that my colleagues are attempting to tie up and in two cases outright prevent. Let me be frank with you, Mr. Chair. I was born in 1951, and I grew up gasping for breath most of my life. Lived in an industrial city, a manufacturing city in Milwaukee, Wisconsin, and I had my first asthma attack shoveling coal into a furnace and then gasping for breath because of the smog that was generated from manufacturing. Thank God for the 1990 Clean Air Act amendments. We've seen tremendous health benefits over the years thanks to the work of the Environmental Protection Agency, and not only the bureaucracy but the courts that have made sure that deadlines are enforced and not simply thrown to the curbs. According to a recent EPA study, we've had substantial and hard scientific proof that protecting our nation's air quality from hazardous pollutants is a very substantial benefit. In 2010, the reductions in fine particle and ozone pollution from the 1990 Clean Air Act amendments prevented more than 160,000 cases of premature mortality, 100,000 heart attacks, 13 million lost work days, and 1.7 million asthma attacks. And we do know that the Clean Air Act regulations by the EPA especially help low-income communities who are often impacted by environmental injustices and other vulnerable populations. A recent two-year-old study by the University of Massachusetts and the University of Southern California analyzed 300 different metropolitan areas and ranked them based on how pollution affects low-income and minority communities. This study cited that air pollution is unevenly distributed within states as well as within them. A growing body of research has demonstrated that people of color and low-income communities often face the greatest environmental hazards. And the area that I represent in the metro Milwaukee area came in the top 10 cities cases. Mr. Chairman, I just would like to add my own personal experience to the body of this research. And Mr. Chair, I would like to reserve the balance of my time.